My name is Dr. Isang, cardiologist, using this platform to be able to discuss things regarding the heart health and prevention and why, because prevention is a lot better than treatment. So, what does that mean exactly? So, that means that if you have a heart attack versus if you have high blood pressure, which is a huge risk factor for heart attacks, it's a lot easier to treat the blood pressure than it is to treat the heart attacks. So, just using this platform to discuss these things because the numbers are just striking. There are more and more people who are having high blood pressure that is not controlled, are obese, diabetes, high cholesterol, strong family history and don't know about it, genetics that are associated with it, smoke, all of these things together are huge risk factors for heart attacks, for heart disease, but not just that. It spirals down into strokes, dementia, a huge financial burden, end stage renal disease or kidney disease, needing dialysis. And it just starts, unfortunately, with a lot of not balanced knowledge, knowledge of what the risk factors are that I previously just mentioned, and just understanding the importance of controlling these risk factors, but also following up with your primary medical provider. Today, I've talked about prevention, talked about all of the different ways that we can prevent it. So, kind of want to knock it off one topic at a time. Today, I'm going to talk about high blood pressure or hypertension, why it's important, what we can do naturally to control the blood pressure, and what we can do with medications to control it a little bit better. If you guys can hear me better in talking like this, I can do it like this too. Boom, cut out sugar, take fish oil, and exercise. Absolutely. Those are one of the, if not, if everyone can do that, absolutely. If they can exercise, getting in, consistently, whether it's 150 minutes per week or, 30 minutes per day, but being consistent with it, watching what you're eating, you are absolutely correct. And especially with sugar, I think the more we start to understand the impact that sugar can does to your life, does to your body, it is drastic. There's a lot of people that I have them controlled. Their blood pressure is controlled. Their cholesterol is controlled, but their diabetes is not. Their blood sugars is not. And because of that, they're having more and more events downstream. It just comes down to, like you're saying, watching what you're eating. And it tastes good, yes, but are you going to let your taste buds be the reason why you die? I've had a close family member of mine that was spiraling down that pathway and they reached rock bottom and now it has changed their life. They've lost over 80, 90 pounds off a lot of medications. No, that's absolutely true. What is it? Time EXT, the importance of exercising and just being consistent. I've seen it in my personal life where I was only exercising 10 to 15 minutes a day, but I was doing it every single day. And fast forward 6 months, I dropped a lot of weight. I dropped about 30 pounds. I was extremely overweight and depressed and just started getting after it. And now that I'm where I want to be, I'm just going to continue to push after it. So, exercise is one of the biggest things. So, going back to the topic, blood pressure, what can we do to help our blood pressure? Time EXC, mentioned basically everything that I was going to talk about, the importance of exercising. Exercising is going to be one of the biggest things. If you can drop 20, 30 pounds, you can potentially get off of one, if not all of your blood pressure medications, because each individual is different. Each individual handles blood sugars, handles the way they hold on to fluid, the way they hold on to salt a lot different, but also handle their weight different too. So the higher your weight is, the harder it is for it to come off, number one, but also the more drastic effects you can have due to high blood pressure. Due to high weights, which includes high blood pressure, which can also include obesity, which can lead to sleep apnea. So controlling your weight is going to be one of the biggest things that you can do. You can look up online everywhere how much you should weigh, given your age, your gender, your height, etc. But dropping weight as much as possible. And there's two mainstream ways that you can drop weight. You can drop weight by monitoring what you're eating, eating in a caloric deficit, but you also have to understand that metabolism plays a huge factor into it. Also, there are a lot of individuals who eat whatever they want, but don't gain weight or even lose weight. So, as you get older, metabolism is a lot difficult. So, it's a lot slower. So, definitely watching what you're eating. The second way is exercising, getting enough exercise in addition to watching what you're eating is going to be significantly beneficial in coming to lose weight. And the second one is stress. And the way people handle stress can be different. Stress can lead to not getting enough sleep. Stress can lead to making poor choices. So, however you want to handle your stress, whether it is with exercise, whether it is with yoga, whether it is with meditation, finding a way to handle your whether it is with a psychologist or psychiatrist, but finding a way to handle your stress is going to be one of the best things that you can do for your body and your health overall. It's probably one of the hidden dangers is stress. Stress builds up into your body, can lead to ulcers, can lead to heart disease, can lead to depression. So managing your stress is going to be one of the biggest things too. Another one is following up with your medical provider. A lot of people have high blood pressure and it is due to something else. And that something else can be sleep apnea. That something else can be issues with hormones, can be perimenopausal, can be thyroid. So making sure that you're seeing your doctor, or at least on an annual basis, to make sure that you don't have any potential other causes of your blood pressure. But this also includes getting routine lab work because low potassium can also lead to high blood pressure. So making sure that your electrolytes are stable. So in addition to potassium, calcium, sodium, magnesium are all stable. But also when you're there, just go ahead and get other labs done too. Check your cholesterol panel, check your vitamin D level. A lot of us are deficient in that. Check your blood work, making sure that you're not anemic, etc. Trying to think if that covers the majority of reasons why people have high blood pressure. And another one is talking to your family members, looking at your family members if they are on blood pressure medications. There's a huge risk factor that you may also have high blood pressure. My parents had high blood pressure, have high blood pressure, and because of that, I started medications for high blood pressure at a young age, despite being appropriate weight. Just the way it is called essential hypertension for a reason, so there's no exact cause. When you do find a cause, and that's known as secondary hypertension, which is high blood pressure due to something else. And following up with your medical provider is going to be the best thing that you can do to figure out why you have high blood pressure. And it can be very helpful because it can help to uncover other things. In addition to blood pressure, you having chest pain, should we investigate whether you potentially have heart disease? Do you smoke? If you do, smoke can lead to high blood pressure, can lead to issues with the lungs, COPD, emphysema. Unfortunately, for some people, lung cancers, etc. So, making sure that you have a consistent follow-up with your medical provider, making sure that you're talking to your family members to make sure that you don't have any genetics that is associated with it, making sure that you're exercising, eating the right things, and handling your stress as best as you can and getting enough sleep. My name is Dr. Isang, and I'm a cardiologist. I use this platform to discuss things regarding the heart, health, and prevention. Thank you.